Well, thank you all for joining us today. We are here because Republicans would rather shut down the government than address a healthcare crisis that is threatening to shut down small businesses across the country. Right now, healthcare premiums are being locked in for next year. And because Republicans have refused to save the healthcare tax credits that millions of people rely on, healthcare costs are about to more than double for families in our country. And small businesses are going to be among those hardest hit by Republican inaction. Small business workers and employees are far more likely to get their coverage through the ACA exchanges. In fact, half of the people enrolled through the healthcare marketplace are small business owners, small business workers, or self-employed people. Here in Washington State, there are 50,000 small business employees and people who are self-employed who are enrolled through our exchange. 1 in 4 farmers get their coverage through the marketplace. Same goes for dentists and real estate brokers, manicures. That's just the tip of the iceberg that Republicans are refusing to avoid. Small business owners know what is coming if Republicans do not sit down with us and figure this out soon. The rate hikes are coming. And for small business who have tight margins, those hikes are going to mean hard decisions. Some will have to offer plans with worse benefits, and their employees will have to pay higher premiums. Some will stop offering coverage to their employees altogether. And many small businesses, which account for half of job growth, will have to stop hiring. Many will have to let people go. Some small business owners may just have to close their doors entirely. That is the crisis we are facing. And Republicans would rather shut down the government than sit down and talk about it. And as I keep saying, Republicans might have shut down the government, but they cannot shut down the debate. And if they can't shut out they cannot shut out the voices of people across the country who are on the front lines of this healthcare crisis, which is why I'm very pleased today to be joined by some Washington State voices who know exactly what is at stake for small businesses if Republicans refuse to save the healthcare tax credits. These stories are exactly what this fight is about. This is who I am fighting for. And I'm going to keep your stories in the spotlight and keep your voices echoing in the halls of power until Republicans finally acknowledge the reality of this healthcare crisis and work with us on solutions to reopen the government and avoid forcing a huge healthcare cost increase on families and small businesses. Thank you, and with that, I will turn it over to Leslie.
All right. Thank you, Senator. So yes, my name is Leslie McNamara. I am a commissioner at Three Rivers Hospital in Brewster, Washington. We are a nonprofit rural critical access hospital. And so I am very concerned about the ACA and naturally for my constituents and friends, but also it hits me personally because my husband is the sole employee of a third generation hardware store and lumber yard. And he received an email a few weeks back warning that his ACA insurance was ending on December 31st due to a lack of funding and the subsidized payments that would not be extended. That's all part of this budget cut. So currently, his subsidized out-of-pocket premiums are around $349 a month, or that's what it would be if we extended it. Without his subsidized payments, his premiums would be $1,131 a month. That's more than triple. And I'm telling you right now, that's 25% of our combined income. That's not affordable. It's simply not affordable. So what are we going to do? Likely, like many others, we might have to make the hard decision not to have health insurance for him at all. And having uninsured people, and not just him, it's a strain on his business. It's a strain on our hospital. It's a strain on every American, because when hospitals are faced with patients who cannot cover their care. Bad debt and charity care increase, and likely all insurance premiums will increase. And that's everybody, not just people who need subsidized health care. And so it's just bad for the economy. It's bad for people completely. It's just, I don't know what people are going to do. We're going to have a lot of uninsured people, and that's just bad, because instead of people having regular health care, they'll end up in the ER. And I just don't know how that could be good for anybody. In fact, my husband needs an operation. We were going to wait until slow part of the year, because like I said, he is the only employee. But now we're going to try to have to do it before the end of the year, because there's going to be recovery and follow-up visits, and he needs his insurance in order to get this operation. We can't afford it without insurance. And so this is a real strain on us. We have some big, difficult decisions to make, and it's both frustrating and terrifying. So I urge every member of Congress, I don't care which side of the aisle you're on, and the president, to think carefully about this healthcare crisis and the needs of all United States citizens, because we matter. Thank you very much. And to you, Stasha.
Thank you, Leslie. It's nice to meet you. I have been in business for over 30 years, and I'm a sole proprietor, and I get my healthcare through the exchange. My husband's retired, so he doesn't work. He's on Medicare, and he doesn't get insurance through a company or a corporation. I chose Regents, and without the exchange, I'd be paying over $1,200 a month. And with the tax credit, I pay $772 a month. And if that goes away, even though I have pre-existing conditions, I'll have to find cheaper insurance somehow. I don't know what I'm going to do. I really don't. And this is the first time that I wondered, should I have gone into business for myself? Was that a mistake? So that's basically my situation. I'm probably better off than most people because I have a full clientele. I work full time. The most stressful thing about my business is around October, when I have to figure out what insurance I'm going to get and what I'm going to have to pay. And that price does not include visual or dental. So it's expensive, and I agree with Leslie. It's terrible for the economy. It's terrible for all Americans, not just sole proprietors, and not just people who have children who are disabled. It's terrible for everybody. It'll trickle down to everybody. If we have to use the emergency room for our healthcare, no one will be able to get into the emergency room. And that thinking about living in a country like that is very stressful. So this is the most stressful part of my job. I love my job, and I have a great clientele, but this is it. So thank you for having me, and that's pretty much it.
Thank you to both of you. I mean, these are the people I am fighting for. This is why I am insisting that Republicans give us a guarantee that we will take up a bill to extend the ACA tax credits. We're hurting small business owners, farmers, people everywhere, and it's going to cost all of us. That's why we're fighting for this. So thank you so much for sharing your personal stories. And Dylan, I'll turn it back over to you to see if any press would like to ask them any questions.
Great. We've got time for a few questions here. If you have a question for Senator Murray or the guests today, please raise your hand and I will call on you to ask your question. And I see we first got a question from Ben at Politico. Ben?
Senator, thank you for doing this. I was wondering if you could respond to both Senate Majority Leader John Thune and Speaker Johnson have said they're not going to put anything in writing on, a potential ACA compromise. Could you respond to that? Because I know you've expressed concern about empty promises or an empty commitment to come back to negotiations only after the government reopens.
Yeah, well, I heard the speaker's words this morning that we couldn't write anything. He is a legislator. What we do is write laws. I don't understand what his comment meant. Absolutely, we can put agreements together. That is what we always do. And secondly, let me just comment on this. Just bring us back into session. We will talk later conversation. Honestly, I taught preschool. This is like a 4-year-old telling you that, just give me that candy bar and then we can talk about the sandwich. That's not how this works. We need commitments that are real. Our constituents who are hurting need a constituent that's real. They don't need a conversation later, and they don't need to be threatened.
Great. We'll go next to Jen Schutt at States Newsroom.
Thanks so much for doing the call, Senator. Speaker Johnson said this morning during a press conference that he spoke at length yesterday with OMB Director Russ Vought, and that he believes Vought is taking an effective sort of pragmatic approach to the shutdown and canceling certain projects in Democratic areas of the state. I'd like to get your reaction to that. And then if you have had any communications from OMB at all about how they're implementing the shutdown or sticking to spending law during this funding lapse.
No, the president and Russ Vought were not given any additional authority under a shutdown, and they shouldn't pretend they have it, and they shouldn't act like it, and they certainly should not be threatening people. What they are doing is hurting people in order to get their way. What we are talking about and what we are asking for on our side is that we, as the federal government, help people, help them get their health care, help them make sure that they get the resources they need at critical times. So they're for hurting people, we're for helping people. Russ Vought is at the top of that, along with President Trump, doing that, and I just say shame on them.
Hammy with Desiree News, you're up next.
Perfect, thank you. When it comes to these spending cuts that Russ Vought is doing, Republican leaders are saying that the Trump administration doesn't want to do these cuts, that they don't take pleasure in it, while President Trump is posting on social media depicting Russ Vought as the Grim Reaper. I'm curious if these social media posts do make it difficult for Democrats to want to engage in any bipartisan talks or negotiations, or what the tone is for Democrats right now.
It really troubles me as someone who is watching our country really hurting today, that the president and the Republicans right now are treating it as a joke. This is not a joke. This is real. They need to stop the taunting. They need to stop the childish behavior. They need to stop hurting people, and they need to come and work with us to solve a serious problem in front of our country.
I don't see any more raised hands for questions, but we've got a little bit more time in case folks do. If you want to raise your hand if you've got a question, or shoot me a message. We'll give it a moment here in case folks have any. All right. Seeing no more, I will turn it back to Senator Murray to close us out.
Thank you. Thank you very much. This is a serious time in our country. We're at a crossroads. Are we going to have a country that hurts people or a country that helps people? I will always be on the side of helping people, and that's why we need to get this deal done. Thank you.